Lupus is a complex autoimmune disease that can affect virtually any part of the body. It's like your immune system decides to go rogue and attack your own tissues instead of protecting you from invaders like it's supposed to. Imagine your body's defense system getting confused and thinking that your own cells are the enemy. It's also a chronic condition, which means it's long lasting. But what exactly is going on in the body of someone with lupus? Well, in a healthy person, the immune system produces antibodies to fight off harmful invaders like bacteria and viruses. But in lupus, the immune system creates autoantibodies that attack the body's own tissues and organs. It's like friendly fire in your own body. These autoantibodies can cause inflammation, pain, and damage in various parts of the body, including the skin, joints, kidneys, brain, heart, lungs, and blood vessels. One of the tricky things about lupus is that it can affect different people in different ways. Some people might have mild symptoms, while others could have more severe issues. It's also known for being unpredictable, with periods of illness, called flares, alternating with periods of remission when the symptoms calm down. In the United States, it's estimated that about 1.5 million people have lupus. Worldwide, that number jumps to around 5 million. But here's an interesting fact. Lupus doesn't affect everyone equally. It's much more common in women than in men. About 9 out of 10 people diagnosed with lupus are women. It also tends to show up most often in people between the ages of 15 and 45. Causes of lupus. The exact cause of lupus is still unknown, but we do know that it's probably a combination of factors. First, genetics definitely play a role. If you have a family member with lupus, you're more likely to develop it yourself. But don't panic if lupus runs in your family. Having the genes doesn't guarantee you'll get the disease. Other factors include exposure to sunlight, especially if you're already sensitive to it. Certain medications and even stress might trigger lupus in people who are genetically susceptible. Some researchers think that viral infections might play a role too. Hormones are another big factor, which might explain why lupus is so much more common in women. Estrogen, in particular, seems to be involved, although we're not entirely sure how. Some women find that their lupus symptoms get worse during pregnancy or just before their menstrual periods when estrogen levels are high. Symptoms of lupus. One of the most common symptoms is fatigue, and we're not talking about your average kind of tired. Lupus fatigue can be overwhelming. Many people with lupus describe it as a bone-deep exhaustion that doesn't go away even with rest. Joint pain and stiffness are also super common. It might feel like you've got arthritis, with achy, swollen joints that make it hard to move around. Unlike arthritis, though, lupus joint pain often moves around, affecting different joints at different times. Skin problems are another hallmark of lupus. Many people develop a distinctive rash across their cheeks and nose, called a butterfly rash because of its shape. It's like someone painted a butterfly across your face, but not in a fun face painting way. Other skin issues can include sensitivity to sunlight, hair loss, and sores in the mouth or nose. Fever is another common symptom, but it's usually low grade, just enough to make you feel off, but not high enough to send you running to the emergency. Some people also experience weight loss, which might sound great if you're trying to shed a few pounds, but it's not exactly a healthy way to do it. Lupus can also affect your internal organs. Kidney problems are common and can be serious if not treated. You might not feel kidney issues directly, but they can show up in blood and urine tests. Lung and heart problems can cause chest pain or make it hard to breathe. And if lupus affects your brain, you might experience memory issues, confusion, or even seizures. One of the frustrating things about lupus symptoms is that they can come and go. You might feel fine one day and terrible the next. This unpredictability can make it hard to plan your life and can be emotionally draining. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of lupus. There's no single test that can definitively diagnose lupus, so doctors use a combination of medical history, physical examination, and laboratory tests to make a diagnosis. One of the key things doctors look for is a pattern of symptoms that come and go over time. They'll ask you detailed questions about your symptoms and medical history. They'll also do a thorough physical exam, checking for things like the butterfly rash, joint swelling, or signs of inflammation. Blood tests are a big part of diagnosing lupus. Doctors will check for things like anemia, low red blood cell count, and low white blood cell or platelet counts, which are common in lupus. They'll also look for certain antibodies in your blood, especially antinuclear antibodies, which are present in almost all people with lupus. But here's the catch. A positive antinuclear antibodies test doesn't automatically mean you have lupus. Lots of people without lupus can have positive antinuclear antibodies tests, so doctors need to look at the bigger picture. They might do more specific antibody tests, like anti-double-stranded DNA or anti-Smith antibodies, which are more closely linked to lupus. Urine tests are important too, especially for checking kidney function. To officially diagnose lupus, doctors often use a set of criteria developed by rheumatologists. You need to meet at least 4 out of 11 criteria to be diagnosed with lupus. These criteria include things like the butterfly rash, photosensitivity, mouth ulcers, arthritis, kidney disorder, and various blood and immune system disorders. It's worth noting that diagnosing lupus can take time. Because the symptoms can be vague and similar to other conditions, it's not uncommon for people to go months or even years before getting a definitive diagnosis. Treatment for lupus. Unfortunately, there's no cure for lupus yet, but there are lots of ways to control symptoms and prevent organ damage. The goal of treatment is to reduce inflammation, suppress the overactive immune system, prevent flares, and minimize organ damage. For people with mild symptoms, over-the-counter nonsteroidal anti-inflammatory drugs like ibuprofen might be enough to manage joint pain and fever. But for more severe symptoms, prescription medications are usually necessary. Antimalarial drugs, particularly hydroxychloroquine, are often used to treat lupus. We know what you're thinking. You don't have malaria. True, but these drugs have been found to be effective in controlling lupus symptoms, especially skin rashes and joint pain. They can also help prevent flares and reduce organ damage over time. Corticosteroids, like prednisone, are powerful anti-inflammatory drugs that can quickly bring lupus symptoms under control. They're like the fire extinguisher of lupus treatment, great for putting out the fire of a severe flare, but you don't want to use them all the time because of potential side effects. For more severe cases, or when steroids aren't enough, doctors might use immunosuppressive drugs. These medications work by calming down your overactive immune system. They can be very effective, but they also increase your risk of infections, so they're used carefully. Newer biological therapies, like belimumab, target specific parts of the immune system involved in lupus. These drugs can be effective for some people who haven't responded well to other treatments. But treatment isn't just about medications. Lifestyle changes play a big role too. Protecting yourself from the sun is crucial if you're sensitive to it. This might mean becoming best friends with sunscreen, wearing protective clothing, and maybe investing in some stylish wide-brimmed hats. Regular exercise is important, even though it might be the last thing you feel like doing when you're tired and achy. It can help keep your joints flexible, reduce fatigue, and boost your mood. Just be sure to listen to your body and not overdo it. In the end, while lupus is a serious condition, with proper treatment and management, many people with lupus are able to control their symptoms and lead a fulfilling life. And who knows? With ongoing research, we might be closer to a cure than we think. Now, we want to hear from you. Do you or someone you know have lupus? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.